Hello everyone, welcome to Progressive Medical Laboratory Technology. Today we are discussing about a very important test in biochemistry, that is lipid profile test. Before starting today's video, I just want to share with you what we will understand today. Firstly, what is lipid profile test? Secondly, what are the purpose of lipid profile test? After that, we will understand what are the P for parameters of lipid profile test. After that, we will understand if this kind of parameter become elevated or decreases, which kind of disease as well as which kind of symptoms may occur. Okay, that's all about today's videos or today's class outline. Okay, without doing any delay, we are starting lipid profile test. Firstly, whenever we are using the term profile defines there will be present lots of parameter, so that we need to understand what are the parameter are present in lipid profile test. See here, firstly there will be HDL, that is high density lipoprotein. After that LDL, that is low density lipoprotein. After that, whenever we are just accumulate this HDL and LDL, we will get total cholesterol. Okay, and after that we will get triglyceride and Tg to HDL ratio. Tg to HDL ratio defines that triglyceride to HDL ratio. After that LDL to HDL ratio, that is low density lipoprotein to high density lipoprotein ratio. That's all about the parameter present in lipid profile test. Now, why we are doing the lipid profile test? It is too much important thing that why we are doing, as well as what are the purpose of lipid profile test. Firstly, detect the lipid abnormalities. Lipid abnormalities means whenever any kinds of lipid are elevated into our body, there can doing, as well as there can happening lots of function as well as function related disease. Okay, now second thing, monitoring the treatment. If any patient are taking the treatment in lipid as well as cholesterol based treatment, we can easily understand or analyze it how the treatment level are going on. Okay, and after that, whenever we are getting the result of lipid profile test, we can personalize, as well as we can personally guide to the patient any kinds of cardiovascular risk are present or not. Into the lipid profile test, it is important to understand that cardiovascular disease means these diseases are related to heart. Okay, whenever lipid become elevated, heart related symptoms we may see into the particular patient. Okay, I hope you are understanding the English language, so that I am just using the understandable English. Okay, after that, we need to understand what are the parameters are present in lipid profile test and what are the normal ranges and clinical significance. Okay, it is too much important thing to understand the component means parameters, normal range and clinical significance. Okay, firstly total cholesterol. Keep in mind that total cholesterol, whenever we are doing and accumulate HDL, LDL and VLDL, we will get total cholesterol. Keep in mind that total cholesterol means whenever we are just summarize HDL, LDL and VLDL. Okay, total cholesterol level is less than 200. If it's high or if it's higher than 200, that is increase the heart disease risk. Okay, or we can say that cardiovascular disease risk can be formed. Okay, after that HDL, that is high density lipoprotein, that is good cholesterol. Why it's good cholesterol? Because it does not creating any kinds of problem into artery whenever the blood flowing are occurring. It does not create any problem. Okay, and what are the normal range? That is less than 40 to 50 mg per dl, milligram per dl. If it's lower, it is it good cholesterol? So that we are saying that if its level decreases, we can see heart related disease may occur. Okay, that is the opposite action of total cholesterol. After that LDL, it is called bad cholesterol. Its normal ranges is less than 100 milligram per deciliter. If it's high, artery clogging means whenever we are seeing that artery, it's a one type of blood vessel, right? Whenever the lipid formation are occurring, this lipid become accumulate here, this lipid become accumulate here, so that blood will not passes properly, as well as lack of blood supply may happening. That is called artery clogging. Understand? After that, that is a triglyceride. Triglyceride means it is one type of fat or lipid. Whenever our body created unused fat, which fats are not uses, these fats are called triglyceride. They are present into the blood. Okay, this triglyceride sometimes gives us energy to doing any work, but if its level high, then we can say that fat accumulation can increases, as well as fat accumulation can form, as well as we can say that the lipid level become elevated. Okay, less than 150 mg per dl, that is a normal range of triglyceride. If it's high, can linked with the metabolic issue. Metabolic issue means the digestion will not working properly, as well as the metabolism will not happening, the breakdown of feed food will not happening. That is the metabolism. Okay, after that, VLDL, that is very low density lipoprotein. Keep in mind that the cholesterol are dividing based on the concentration or density of lipoprotein. If it's high, then we are saying that high density lipoprotein. If it's low, then we are saying that low density lipoprotein. If it's too much low, then it's called very low density lipoprotein. Understand? After the, what are the normal range? That is the 2 to 30 mg per dl. Okay, and if it's high, that is the risk of plaque build up. Plaque build up means, I have already discussed that whenever the artery become blocked with lipid, that is called the plaque formation are happening. Okay, so that we have already understood the parameters, normal ranges and clinical significance. Now it is a high time to discuss about how to we decreases our cholesterol level, as well as how to we manage our cholesterol level. See here, firstly, diet. We can maintain fruit, and we can take fruit, vegetable and lean proteins. It will help us to maintain the cholesterol level properly. Okay, after that, exercise. We are sometimes advising to our older persons into our home as well as surroundings that please do the exercise. It will help to prevent the accumulation of cholesterol, right? So that it will help. Minimum 150 minutes per week if you are doing the exercise, it will help to maintaining your cholesterol level. Okay, after that, weight management. Weight management means you have to maintain your weight properly. What do you mean by BMI? That is basal metabolic, M for metabolic, I for index, that is basal metabolic index. Okay, after that, avoid smoking and limit the alcohol. If you are consuming too much alcohol, that is also bad for your health. That can accumulate and that can increases your fatty liver. Understand? So that's all about the lifestyle modification. You will get everything into a report. Whenever you will see the reports, you will see this kind of parameter. Okay, now here see, if the HDL cholesterol, that is a normal artery, if the LDL cholesterol or bad cholesterol are accumulates into the artery, see here, that is the artery is normal, right? So that the blood flowing are occurring properly, but here is the artery are narrowed. Here see, into the two sides there is the accumulation of lipid or accumulation of LDL are happening. It can causes the lack of blood supply. After few days or after few months or after few years, it become blocked. Okay, whenever the it become blocked, the blood will not goes to the heart properly, then heart block may be formed. As well as there is a term that is called atherosclerosis, that is also happening due to the abnormal level of lipid. Okay, thank you very much. today's video up to this much. Thank you.